Calluses like this can tell a lot about you. Today we're going to talk about why you're developing those calluses around your heel and how they can lead to painful fissures. Hi, I'm Dr. Richard. And I'm Dr. Blanchette. We're both board-certified podiatrists and foot and ankle surgeons.
We really think today's video is going to help you. We have so many good tips. Let's dive right in. What causes heel callus and cracked heels? Callus build up because of pressure, friction, and then as the callus builds up, the skin loses its elasticity. So it's less flexible and more prone to crack.
It's similar to a branch from a tree. If you take the branch from a tree that's still green, you can bend it. But if you leave it outside for, a couple of weeks and you come back, you're gonna try to bend it, it's gonna crack. Heel calluses and fissures are so important to treat, especially in patients with diabetes, because they can create a port of entry for infection and cause a big problem. And also for people that don't have diabetes, it's important too because they're very painful. And then walking on a cracked heel is not fun.
Let's go over a few different causes. Number one is a high arch foot.
Cavus foot type or high arch foot are gonna have a lot of pressure at the front of the foot and the heel. Instead of having pressure distributed throughout the whole foot, it's just gonna be concentrated there. They also don't have a lot of shock absorption. So basically when they're walking, they're just pounding the ground like this. Cause two is systemic conditions.
Certain medical condition can lead to have more drier and cracked skin. The most common one are diabetes or hypothyroidism. So what happens is that there's decreased sweat production, dry skin, more risk of cracking. Number three, fat pad thinning.
As we age, we start losing fat. But unfortunately,
not where you want.
The places that you want to lose it. So the bottom of your feet is one major area where we lose fat, and that's called fat pad atrophy. If you have less cushion on the bottom of your heel, well, it's going to cause a lot more pressure.
And the fat pad is also there for a reason. It does shock absorption. So as you lose it, there's less shock absorption, more pressure, more friction, more callus.
Cause four, open back shoes.
Unfortunately, open back shoes like flip-flops, sandals can create more heel callus. Because the heel is not contained at the back, it goes side to side, more friction and more buildup of callus.
The other thing also that happens is that because it's not enclosed, there's no humidity that stays around the area, so it can dry out more easily.
Last thing, when you don't have a back counter of a shoe, the fat pad can splay more. So it's not all contained underneath your heel that creates that nice cushion. Number five, weather.
This can happen both in winter and during the summer. So during the summer, like we just mentioned earlier, more people are in sandals with their heel open, so they're gonna have more dryness over there. But during the winter, what happens is that we crank up the heat and then the air is much drier and it can cause more callus and more cracking.
Okay, the fun part. Now let's go over the treatment. I'm gonna give you a lot of information today, but don't worry, you don't need to take any notes. We created a free PDF so you have all the information right in front of you. In-office treatment, and it's basically surgical debridement of the callus.
We take a sterile blade and we're gonna shave down that dead skin, that thick skin, to go back to now to the nice soft baby skin, and it's gonna help to heal the cracked heel. The advantage of not having that layer anymore is that everything we're gonna talk to you about later, creams and things like that, are gonna penetrate much easier.
Shaving the callus is generally painless. But if you do have fissures, as we clean the fissures edges, that can be a little sensitive, but just tell your doctor, they're gonna take it easy. Afterwards, you're gonna feel so much relief. It's worth it. I hate to do this, but can you please like, subscribe? I know everybody is asking you to do that, but it does make a massive difference. So if you find any value, please like, subscribe. It's a free way for you to show your support.
At-home maintenance. Now let's talk about things that you can do at home now that you have this nice soft baby skin.
But first, safety. If you have diabetes, poor circulation, or peripheral neuropathy, that means you don't really feel your feet, do not attempt to do things at home by yourself, you do need to be evaluated by a doctor first. Pumice stone.
A pumice stone is going to be very helpful to maintain that nice soft skin. It's better used after the shower. You can use it around your heel until it's soft and use that about 2 to 3 times a week.
I personally prefer the glass pumice stone. It really leaves a really clean, smooth baby skin finish. And if you're interested in any of the product, we do have an Amazon storefront. You can look it down below.
Best creams for cracked heels.
The scientific studies have shown that the best combination of cream for cracked heels are Urea 40% mixed with glycerin and also Petroleum Jelly or Vaseline.
Combination of those 3 creams is going to offer 3 different things. The Urea is going to offer some keratolytic property. It's basically to remove that thick skin on the top. The glycerin is an emollient. It's going to moisturize the skin. And the Petroleum Jelly is going to cause an occlusive layer to keep all of this good stuff close to your skin.
Pro tip, if you want the best result, apply those 3 creams at night and then put an additional occlusive layer by putting saran wrap on top of it or even those silicone socks and go to bed. You're gonna get the best result. Fixing the root causes.
First thing that we can do is to use proper shoes. Like we mentioned earlier, to have an open back shoes can lead to callus and fissures. So the solution is simple, just to use a shoe that has a back contour. It's gonna help to decrease the friction. It's also going to keep the fat pad closer to the skin as well as keeping the moisture.
But we're also realistic, right? During summertime, sometimes we wanna wear sandals, but make sure if you wear a sandals to use them sparingly. And you can also get the sandals that have straps around your ankles so there's less back and forth of your heel.
Lastly, choose a shoe that has a nice cushion in the back so that it's going to absorb the shock better.
Custom orthotics.
These are very important when you have callus on the heel, especially the people that have a high arch foot. The high arch foot, like we've mentioned in another video, is going to have a tripod effect, meaning that there's a lot of pressure at the heel and also a lot of pressure on the front of the foot. But if you have an orthotic, and now you're going to bring the ground to the arch, you can distribute that same pressure evenly throughout the foot, decreasing the pressure at the heel. Fat pad taping.
One of the great treatment that a lot of people don't know about is fat pad taping. That means taping your heel to bring the fat all underneath your bone so you have that cushion and shock absorption. Works best especially if you have the callus right underneath.
Let's show you how it's done. You need 3 strips of tape that are pre-cut. Number 1, take it and anchor it at the base of the heel over here. And then now we're gonna pull on it and tie it on the other side. Second tape, we're gonna go about halfway overlap, anchor it over here on the other side of the heel, and we're gonna pull the side here. Lastly, we're gonna take this tape to anchor everything together. Start on one edge and secure everything up onto the other side. Make sure you rub to activate the adhesive.
Pad injections.
This is a great technique to use for people that really don't get relief with any other conservative treatment. This is actually to take some extracellular matrix of fatty tissue and to inject it into the heel. Then your own cells are going to migrate into this little scaffolding and rebuild more cushion on the bottom of your heel.
This procedure is done under local anesthesia. That means that the doctor will numb the area first and then the fat injection will be done.
One important thing is that you usually need to be non-weight bearing for a couple of weeks after the injection because you don't want to start walking on it because the material is going to start to spread out, but we want it to be concentrated where exactly we want it. And this worked really well for people that have this center callus. Systemic treatment.
We're not going to go into too much detail about this one, but basically if you have diabetes or hypothyroidism, like we described earlier, conditions that are going to decrease the sweat production, go see your doctor to treat those underlying systemic issues. Heel products. Now let's show you all the goodies that we have.
The first product is a Tuli's heel cup. Those are Podiatrist design and they absorb the shock by using a patented multi-cell waffle construction that mimics the foot's natural fat pad. It's really easy to use. You just put them in your shoes and you can put your foot in and it's going to decrease the pressure there. Product 2 is a heel protector. This product can be used directly on the foot, so you don't need to put shoes on because there's a Velcro strap at the top that will keep it in place. There's a cushion around the edge there to decrease the pressure and absorb the shock better. You can put it on. You could still put it into a shoe if needed. Next products are gel heel cups. They are made out of very soft material that will help to absorb the shock better. They're not great for plantar fasciitis, but they're great for calloused heel. You can put them directly into the shoe and they have an adhesive layer to prevent them from moving. You can also put them underneath the liner of the shoe as well. Last products are moisturizing heel socks. They come in a box of 6. They have gel silicone inside, which will help to cause an occlusive layer after you put creams on your feet. This is better used at night after you use the pumice stone and the creams. It will create an occlusion and keep those good products close to your skin for best results.
Okay, that's a wrap. If you follow the instructions that we outlined today, you should have some nice baby skin on your heel. And if you don't want to forget anything, make sure that you grab your PDF that's linked in the description down below.
And all the products can be found on our Amazon storefront. And of course, it's in the description as usual.
See you next time.
Ciao!